If you started looking into this for focus issues, but you're realizing anxiety and sleep are actually the bigger picture, you're not alone. Maybe it's your child who can't focus during the day, worries about everything, and battles you at bedtime every single night. Or maybe it's you, dragging yourself through the day, but the minute your head hits the pillow, your brain turns on like a TV, replaying every conversation and worrying about tomorrow. If you're thinking, this isn't three separate problems, it's all tangled together, you're absolutely right. I'm Dr. Dody from Dody Chiropractic Center for Wholeness in Littleton, serving individuals and families across the Denver metro area. This is a quick note, not medical advice here. I'm just walking you through the connected patterns we see every day. Here's what's actually happening. I call it being tired and wired. Your brain and your nervous system are stuck in survival mode. Think about it. If your system thinks it needs to stay alert for danger, it's not going to let you sleep deeply. And it's definitely not going to let you sit calmly and focus. The same system that's supposed to help you focus during the day is also supposed to help you calm down and shift into sleep at night. When that system can't shift gears, it shows up as all three: focus struggles, anxiety, and sleep problems. Now, this looks different depending on your age. In young kids, being tired and worried often looks like bouncing off the walls or melting down over tiny things. In teens, it's staying up way too late on their phone, then being wiped out and unfocused the next day. In adults, it's dragging all day and then having racing mind the minute you try to rest. Different ages, same stuck system. When we look at brain maps and nervous system scans for people who feel like this, we usually see one main issue. The system can't shift gears. It stays in go during the day, so focus feels hard, and it stays on at night, so sleep feels hard. The body keeps sending the signal, stay alert. So daytime focus gets harder and nighttime sleep gets harder. That's why doing a sleep supplement, some breathing exercises, and a few focus strategies can help a little, but it often doesn't fix the whole thing. You're treating three branches of the same tree. So instead of asking, is it ADHD or anxiety or sleep? The better question is the system stuck in overdrive? To see real, lasting change, we need to help the brain and the nervous system learn how to shift gears again, how to feel safe enough to actually rest. That's where our brain-body method comes in. When we use neurofeedback to train the brain and gentle KST chiropractic to support the nervous system, we start seeing that upward spiral. When the nervous system calms down, sleep improves. When sleep improves, anxiety naturally drops. When anxiety drops, focus becomes easier. They're all connected. That's why addressing the root pattern works better than chasing three separate symptoms. Many families tell us sleep is usually the first thing that starts to shift. Then, emotional regulation, fewer bigger reactions to small things. Then focus starts to feel more natural instead of forced. It's not identical for everyone, but it's the pattern that we tend to see when the system learns to shift gears again. If this tired, wired pattern sounds exactly like what you or your child are experiencing, click on the link below to schedule your free 15-minute doctor consult. Pick a time that works. You don't need to prep anything. We do it either by video or phone. And if it's for your child, they don't even need to be on the call. We help you figure out what's driving it: focus, anxiety, sleep, and what a realistic plan would look like. No pressure. If you've tried everything, go watch my next video where I'll walk you through who tends to do well with this approach, what realistic progress looks like, and how we keep adjusting the plan based on what we see. Go watch that next, and I'll see you there.